When men come in and are evaluated for male factor infertility, they respond a lot more emotively than people might otherwise think, because men typically have kind of this, keep it in, not express, your true feelings and internalize. But in the intimacy of when they have the opportunity to share that diagnosis with a professional like a urologist, they really, in the moment, are very much in denial sometimes. So for example, if the diagnosis is azoospermia and that there are no sperm in a semen analysis, very often men won't think that the test is correct, or if it's a really, really poor test. And so sometimes the initial reaction can be denial and shock. And then over time, as the diagnosis, a man lives with the diagnosis, has more questions answered, goes through the process of maybe some additional evaluation, the reality does sink in, but there's a complex set of emotions. It's not a predictable course, of course, but men go through grief, they go through frustration, anxiety, sadness for sure. And they also have reported in our research that they suffer from questions of their virility and their ability to get their partner pregnant, so to speak. And this really can impact their perception of their masculinity and just in general their purpose. Men typically do not really want to disclose to their friend network. They tend to not acknowledge to their social circle that they have this diagnosis and the treatment that they're going through. And sometimes there can be some dissonance between the couple, because the female partner might share the male diagnosis with, say, her mother, and he doesn't really want her to. But oftentimes men recognize that women need to be talking about these things, and they kind of just agree to disagree about that. But yeah, men typically aren't so much into the disclosure of their diagnosis. To help men cope, I would say as healthcare providers, the best thing we can do is include men. Our healthcare structure right now is very female facing, and what that means is we provide healthcare primarily in the reproductive setting to women. It's centered around the woman, and logistically that makes sense because she's the one that takes on the physical burden of the infertility treatment. Men certainly have their part when there's a male factor component to it, but it is structured around her. And very often what that means is that men are left out. And so they have these needs, both physical and emotional. So they have a physical need to be evaluated if there's an underlying condition to the infertility, and they certainly have the emotional needs, but very often men are kind of pushed to the sidelines. And so I would say we as healthcare providers need to be much more thoughtful and intentional about making sure men are equal partners in this process, and really kind of take a family-centered approach to healthcare in providing for them as a couple, as opposed to a woman we're trying to help her get pregnant and her male partner who is the gamete donor. The future of male fertility is hopeful. It's been in the shadows for a very long time, and men's experiences and men's access to fertility care has really been underutilized. And when Dr. McElhaney and I started collaborating on our research together, it wasn't nearly as talked about in professional circles as it certainly is today. In the last few years, we definitely have seen more people in clinical settings and research areas really have a call to do more and do better for our patients. And there's more interest in both meeting those psychosocial needs of men, but also obviously the scientific and biological needs. There's a lot more research that's being focused on the male side of the equation. I do think the landscape for men is going to change. We have a long way to go for sure, but the needle is moving.